take them into their pain. That's the essence of myofascial release, to go into your pain and dissect it. Feel what's happening inside. And when we truly go inside of the pain, it's no longer registered as pain. It becomes either a sensation to experience, an emotion, or it's a type of experience. I call it S.E.E. S-E-E. Sensation, emotion, or an experience it will have. An old memory may show up, some noise, some movement. They will then find some movement into that part of their body when they really get in there. But there's also something so valuable and necessary into asking people what feels good in their body. Because especially if they're in chronic pain, they're conditioned to notice what doesn't feel good, what hurts, what's in pain. And that's taking up a lot of their brain
Real estate?
yeah, something like that. Brain real estate, what would be the word I'm looking for? It takes up a lot of their focus. It's all about how I'm feeling the pain. Their mind's always going there.
That seems like such a nicer invitation to ask them, does this feel better? Or does this, you know? Because when I just ask, so how does this feel?
Yes.
And you, like you said, it puts the pressure on them when they don't know, and they're like, I don't know, and they get irritated sometimes, and they're like, should I be feeling something, you know? And
Or they just say good.
yeah, yeah.
Fine,
good.
fine.
That's such a nice, gentle invitation to like explore.
It gives them, they're part of the process.
Yeah.
Gives them inspiration. And it is really simple. So like when we were doing this, you know, you're assessing, where does it feel most comfortable for me as a therapist to do the work? You can rely on that as that's what's best. If you're not comfortable, there are exceptions to that rule, of course. There are exceptions where when your body's hurting and torquing, it's perfect for them. And that's up to you if you want to do that, right? But for the most part, I really do feel it's a principle that when you're feeling really good with what you're doing, it's feeling really good with them. Now, there are exceptions to that rule where sometimes it's feeling really good to me and they're not feeling anything. But, you know, ask them, does this feel better for you? Or does this feel better for you? Or does this feel better for you? And they may say all of them. All of them feel okay. And then you can say better. Which one's the best? And you're asking them to get in there and make a decision. Feel what's happening. So you're bringing them out of dulldom. Being dull with their body. Being dull with what's happening. And you're asking them to come alive, really, bringing them back to life and presence in their own body.